निश्चयं तस्मात् बहुश्रुतः शास्त्रं विजानीयात् चिकित्सकः. A good physician should inculcate the habit of learning and understanding the scriptures after having the knowledge of several disciplines to arrive at a conclusive essence. The cardiac diseases being one of the mortal causes of mortality worldwide, it is necessary that we understand the cause, pathology, prevention, as well as management of cardiac ailments through various disciplines of Ayurveda. Hence, we look forward to an exposure about what the best of the brain thinks about this very dynamic issue. Hope that we all will learn a lot in the span of 2 days through our eminent resource persons. So, without taking much time, let us begin with the core of event, the scientific session. Firstly, I request Dr. Vijendra Sir, Professor, Department of Kaya Chikitsa, SDM College of Ayurveda and Hospital, Udupi, to chair the session, and Dr. Pankaj Prasad Sir, Principal, Bapuji Ayurveda Medical College, Shivamogga, to co-chair the session. And I request Dr. Prashant Sir, Assistant Professor, Parval University, to chair the session. I request Dr. Ashok Sir, Professor and HOD, Department of Prasuti Tantra and Stri Roga, to escort the chair and co-chairperson to the stage and offer them the floral greetings.
I request our beloved principal, Dr. Leela Sir, to welcome our chairperson and co-chairperson with a floral greeting. As we all know, Smriti is one among the Ashta Aishwarya. We have with us Dr. Pankaj Prasad Sir. I request Dr. Harshavardhan Sir to kindly escort Sir to the dais. Request our beloved principal, Dr. Leela Sir, to welcome Dr. Pankaj Sir with a floral greeting. all know, Smriti is one among the Ashta Aishwarya. The power of the mind to retain, reproduce what is learned is called Smriti. To explain this complex concept, we have a very dynamic personality, Professor Dr. KV Dilip Kumar sir, who's loaded with abundance of knowledge on techniques of Smriti. He has developed a unique psychotherapeutic method called Smriti meditation aimed at prevention and treatment of psychosomatic disorders. Sir pursued his graduation from the prestigious Vaidyaratnam PS Warrior Ayurveda College, Kottakal, Kerala. After successful graduation, he completed his MD at the Government Ayurveda Medical College, Bengaluru, Karnataka. He began his career working as lecturer back his alma mater, Vaidyaratnam PS Warrior Ayurveda College, Kottakal. Subsequently, he became the professor and head of the department of Postgraduate Department of Preventive Medicine. He is the founder and director of Clinical Research Institute of Yoga and Ayurveda. Currently, he is the vice president of the Ayurveda Russian Indian Association. Sir is also a teaching professor at the Institute of Oriental Medicine of the People's Friendship University of Russia, Moscow. He has been conducting lectures on Ayurveda, therapeutic yoga, Ayurveda psychotherapy, etc. Sir has also authored several books and articles related to yoga and Ayurveda. Sir, we are blessed to hear from you about your experience of psychotherapy in cardiology. Over to you, sir. Delegates, kindly note, any queries, doubts about the topic, you can write it in a small sheet of paper and pass it on to the volunteers. The questions will be submitted to the resource person at the end of the session. Thank you.
Okay. Can I have a little water? Can I have a little water, please? Okay. I got it. Very good morning to all, and thank you for inviting me for this wonderful conference here in KVG Ayurveda Medical College, Sulia. Especially in connection with the very auspicious occasion of celebrating the silver jubilee of Rajiv Gandhi University of Health Sciences. And I am, from the deep of my heart, express my gratitude to Professor Dr. Leeladhar, Principal, who invited me for this occasion. And I am glad to meet you all. Especially I am very glad to meet Dr. Rohini Madam. She was my senior there after a long time we are meeting. Okay, thank you, sir. Okay, let us start with a short meditation. I know that meditations or keeping quiet or silent is not so very wonderful, joyful experience for all of you. But let us try a short meditation and we will go from that. Okay? It's a simple meditation, a short meditation. What you have to do is just close your eyes and just feel that instructions which I am telling and feel your emotions and sensations. That is very important. Okay, please close your eyes and sit comfortably. As you are sitting comfortably and feeling the surroundings, just be aware of that surroundings where you are. Okay, you are feeling your presence in this big, wonderful hall, just feel it. As you are feeling this calm atmosphere, silent atmosphere, you can feel the temperature, the air and the smell of this room. And you can feel the presence of the august audience around you. Just feel them and just relax. As you are relaxing your whole body from toes to head, just scan your body and feel that the body has deeply relaxed or not. Just verify it. Just scan from the toes upwards, ankle joint, calf muscle, knee joint, thigh muscles, hip joint, and the entire abdomen. You are scanning chest and both shoulders and the head. As you are scanning, you can identify that which part is more deeply relaxed and which part is not yet relaxed. Just be aware of it. Just observe and feel that sensation in your body deeply. Deeply you feel all the sensation in your body. Just sensitize that changes happening in you. At the same time, you can imagine a flower in front of your eyes. Just look at the flower, its color, shape and size, and feel your emotion when you are attached to this flower, when it is appeared to you in front of your eyes, when you are feeling the smell and the touch, the color, the size. As you feel the flower deeply, you keep this flower close to your heart. And as you feel the flower inside your heart, look at the flower, how it appears to you. Whether it is very energetic, beautiful, healthy, or not. Just feel, deeply feel your emotions. As you look at the flower, deeply feel your emotion. And just deeply feel how your heart is reacting to that emotion. Just feel that. Just feel your palpitation. Just feel the rhythm. Just feel all the sensation. Just deeply feel all the emotions. Deeply, deeply, deeply feel. You can count the beats of your heart. You can sensitize the heart very deeply. You can experience the heart close to you, very close to you. Just experience your heart very deeply, deeply. And just feel that what your heart is trying to convey to you, what your heart is trying to make you feel. Just deeply understand that. Feel it deeply. With that feeling, you can take a deep breath. Inhale and exhale. And rub your palms and make it a little warm. And wipe your face. emotions are very significant. We all know that. When we are having any emotion for that matter, sadness or happiness or fear, immediately our heart feels. But unfortunately, we are trying to abscond. We try to mask our real emotions. We try to look at our TV screen, or some people can smoke, some people can drink an alcohol, some people can eat more food and food so that distract the mind, not to be aware of it. So without awareness, how you are going to cure? So that is the message we need to teach everybody. I am sure that Ayurveda is very much for that. Because the awareness is the most important thing in healing. So let us come to that. And for that, first of all, my chairpersons here, Dr. Vijayendra, Dr. Pankaj, and Prashant, with your kind permission, I would like to go to the topic. Thank you. Okay, role of Smriti meditation and Ayurvedic psychotherapy in cardiology. In this presentation, I am trying to deal with topics like mind-body relation in cardiology, Ayurveda perspective for the psychosomatic diseases, and psychotherapy in Ayurveda, Smriti meditation, which is a tool which we have developed for managing psychosomatic diseases on the basis of Ayurvedic pathology treatment. I will describe it in detail and the role of Smriti in cardiovascular disease. Okay. I would like to start with the story of Ravi. Ravi is a bank employee working in Dubai. He is 41 years of old, and he has born and brought up in Dubai only, and his parents were there. And the early childhood, he was a lonely child. He is the only child, and he was lonely because of that. He was living in another country where he didn't have friends or relatives there. So he had got a very good pampering and caring from their parents. And he was happy about it, and he studied his BTech and completed post-graduation also. He got a job in a bank in Dubai, and he's well settled, and even he got married. And by that time, his father went to Kerala. He is basically from Kerala, and the father went to his native place. From there, he got a strong. And when it was informed to Devi, in fact, he started realizing that what is wrong with him. Because he didn't know that when he was receiving that information that the father is having stroke and admitted in the hospital, what to do? Then immediately he called his friend. See, my father is in hospital right now, what should I do? He doesn't know, because he is brought up in such a situation, because he was not observing how people are behaving when such situations are coming. Then friend told, of course, if I am in your place, definitely immediately I will pack my things and I will fly to Kerala, because father is the most precious person for me in the life. Oh, that is the time he started thinking, okay, I should go to Kerala and meet my father. And he came to Kerala and he went to hospital. He didn't know that what to do. But all his relatives and friends are coming and they are discussing about father's health and all. They are going to the doctor and consulting, and they are inquiring what is going on with his father. And whenever he is having some complaint, they go to the nurse and complain that some symptoms are there. But he was not knowing that what to do, how to respond to this point. But later he became, everybody went, he is alone there as a bystander for his father. He didn't know that how to deal with the situation. Even a mild symptom, he rushed to the nurses that he is having a very severe problem. The nurses will not take much care. It's usually, don't worry, everything is okay like that. So like that, this was a very terrible, stressful situation in his life. First time in hospital, looking after when father is in something like a deathbed. But at that time he developed a lot of anxiety and stress. When he came back, okay, father recovered from that situation and he came back to Dubai, and he found that his blood pressure is highly increased. And not only that, he noticed that even with the help of the doctors, it was like a kind of a white coat hypertension. So whenever he think about a hospital or a doctor, immediately his hypertension shoots up. So this is a condition. Then he started his behavioral change. He started eating more. He became very lazy, anxious, and he was not able to do his regular exercise and all that. So his cholesterol increased. So like that, later he developed diabetes also. Then after 2 years, his father expired. And then recently when he called me, and this is a situation that his mother has got some illnesses. His mother is having some edema in her legs, and he has to take the mother to hospital. He is so much afraid of going to hospital. And he went and he found that it is 200 and his blood pressure is 200 by 110. And he doesn't know how to manage it. So I was giving a meditation over the Smriti meditation I was suggesting for our video conference. And during that time, he saw that as if he is in a Kerala house where his mother is in deathbed, and he is there, and suddenly he got a fear. The fear is, maybe we expect that the fear is that his mother. No, he was afraid of that. If something happens to my mother, who will cook food for me? That is the feeling he had. And also, he started fearing what to do in this moment. I don't know what to do. So his child started waking up, and the child experienced that helplessness and hopelessness in this particular situation. So at the end of the meditation part, he realized that first of all, his fear about the hospital and the illnesses of his close relatives, not because of that his empathy for them or sympathy for them, rather than his selfishness. He is very, because like all of us, we are all selfish when we are thinking about death of our close relatives. Of course, it is there, but at the same time, we are concerned about what we are going to lose. We are going to lose a care or a pampering or a support. So that is the real reason within him that he was worried about. And also he realized that there are certain things which I am in control, but not everything. So what I have to do, that I should realize that I have to follow that. Not that I'm not a God. I cannot save everybody's life. But I should be aware of my dharma in this particular context, and I have to do that. And he realized that I need to get rid of this fear and anxiety which I am carrying. And I need to follow, I need to have a real goal in my life. This is very important. Because he was not knowing that what is his goal, where to go, what he has to achieve. He was just living for making money and for happiness and pleasure, but he was not having this real goal. So he understood that, okay, being a son, I have some responsibility. Being a father, a husband, I have some responsibility. And as a bank employee, I have got some responsibility. But finally, I need to find another final goal, which is really meant for me. That is something like a liberation or realization of who am I or what am I. So this is the realization he had in meditation. And of course, I am sure that it helped him. So what I am trying to say that there is a significant role in mind in the bodily development of any disease for that matter, in particular to cardiology. So there are some studies show that 20 to 10 to 25 years of life expectancy reduction in patients with the severe mental disorders. And cardiovascular disease is one of the leading causes of the death among the people with the severe mental disorders. And we all know that this type A personality behavior in relation with the cardiac disorders. Friedman and Rosenman has observed in 1960s. And the very famous Inter-Heart study has found this a very strong association of many modifiable risk factors in myocardial infarction. And in that, one of the most important factors is that psychosocial factor, which includes work stress, financial stress, family stress, social stress, all these stresses. But we are just generalizing the stress. We say that okay, stress is related to cardiac disorders. But unfortunately now we are not identifying the root cause of the stress and to tackle them in a very specific manner. So it is the pathophysiology is very clear. When there is a stress, that HPA axis is stimulated, the hypothalamus is stimulated, and it produces CRH, and it triggers pituitary gland, and then ACTH is released, and then adrenal glands are stimulated. So a lot of cortisols are released, and when most of the cortisols are released, it disturbs the entire metabolism, and which leads to metabolic syndrome mostly. And with that metabolic syndrome, it finally develops the coronary heart disease. So it is a vicious cycle. The mind-body reaction is a vicious cycle. Like that. When there is a cardiac event, including heart failure and stroke and heart attack, it can lead to depression or anxiety or PTSD. And then in turn we are prone to use that many antipsychotic medicines, and this usage of antipsychotic drugs itself will cause again obesity, insulin resistance, diabetes, heart attack, and arterial fibrillation, stroke. And with that again anxiety and depression aggravates. That increases some particular behaviors such as smoking, inactive lifestyle, or failure to take medicine. So again, it leads to cardiac events. So it's a vicious cycle. That's why the body and mind is totally interconnected. A recent study published in JEE, which the study conducted in my department in Kottakkal Ayurveda Sociology department, and there the study done by Nifina and Anupama Krishnan, it showed that a very strong association between tear suppression and bowel suppression. No, okay, Vega-Rosa's is very much clearly mentioned in Ayurveda, and it is the relation is mentioned. But what is meant by this tear suppression and bowel suppression? Tear suppression is nothing but suppression of the sadness. When we are not in a position to express our sadness, and we hold it back, and it disturbs our system. And also the bowel, especially the constipation, is an outcome of most of the fear in the IBS and in all other fearful situations that bowel suppression is also happening there. So there is a significant association. It is very well said in Ayurveda, and it is proved. It is fine. So we have to think always that the involvement of mind in any kind of disease for that matter. This holistic view of a human being is very well mentioned in Ayurveda as well as in Yoga. Sharirendriya Sattvatma Samyoga Dhari Jivitam. So whenever we look at a person, we should look not just only at the body, but as a whole. The same is mentioned in yoga also. Panchakosha, Annamaya, Pranamaya, Manomaya, Vijnanamaya, and the Anandamaya portions. So they are together we have to visualize or understand. In order to, for the manifestation of disease or even for the treatment, we need to have this multi-dimensional understanding of the human existence, and then only we can cure the disease completely. Otherwise, just we are pacifying some symptoms. So this because of this multi-dimensional existence of the human being, there are multi-dimensional, multifactorial causations for disease. The many, because in the Ayurveda, when we think about the etiology of any disease, it is not just some smoking or sugar eating, something like that. There are multiple factors for that. First of all, Ayurveda says that avidya is the basic root cause of all the disease. And because of the avidya, prajnavarada occurs. This is pratibhramsha. And because of that, so many other etiological factors are happening because of that prajnavarada. So where to treat? If you are thinking about nidana varivardhana, where to address? Initially we need to address the avidya. Then we need to address the prajnavarada. Then only it is important to address the other factors like the immediate reason etiological factors. So here you can see that there are factors like age, willpower, food, seasons, sleep and exercise, place and sex. All these are considered as causative factors or etiological factors for any disease. But they are interconnected. They are mutually in a reciprocal manner they are functioning. So that's why when these factors are all coming together, but finally it is all affecting the mental state. And when the mental states are affected very badly, that will affect the immune system. When the immune systems are affected, that deteriorates and finally that barrier losses that they will penetrate or percolate into the level of the body, and doshas are disbalanced, that will lead to this manifestation of disease. You know, prajnavarada is very, very important. No doubt about it. Why it is important? Because that, first of all, the Brahmsha, we are making mistake in the real judgment of what is good and what is bad for us. Not only at the physical level, but for the mental level also. We need to know whether I am doing something good or bad. Because now medical system has developed in such a way that we have given the utmost importance to awareness. What is the ultimate treatment protocol? Health awareness protocol. When there is a COVID-19, when we are experiencing what to do, be aware how it is spreading. What are the behaviors, modifications we need to do. So if we are aware of that, if we are aware of the nature of the virus, if the nature of spreading, then we know what to do, how to manage it. But if you are not aware, what will happen? It will spread like anything. It will cause death. So, Buddhi Brahmsya is the very important reason. The second thing is that the Dhridi Brahmsya. There is there are people who knows everything. That they can give a lectures many hours about something, but when it comes to their own lifestyle, their own behavior, we don't see that there. In order to continue their talk in such a long period, they have to take little alcohol in between, or they have need to smoke. So then they will get more boost and talk. So why? Though they are aware that it is harmful, it is going to kill them, but they cannot resist. They cannot resist their temptations. They are lacking the willpower. And we, being doctors with cardiological disorders, we used to give a lot of do's and don'ts. Don't eat fatty food, don't eat sugar, don't eat heavy food. So we have to do exercise. Many things we are giving, many advices. We are very good in giving advices, very confident in giving advices because it doesn't cost much for us. That's why. But we don't teach them how not to eat sugar. Though you are a diabetic person, when you feel eating too sugar, the temptation is too much, how not to eat? We are not teaching them. When you are a binge eating habit, you don't teach them how not to eat more than what is required. So many things we are, or smoking. Smoking is injurious, it is written very well. Alcohol is injurious, smoking is injurious. But does it work? But how, it is our responsibility to teach them or to train them not to smoke, not to drink alcohol. So the medicine should focus on such things. So we have to improve the willpower. So intelligence is there, knowledge is there, but in order to apply it in their lifestyle, it is very important to have this willpower. So that is lacking. And in Smriti, what happens is Smriti Bharamsha. That is most important, I should say that. Because of that, whatever we are now, right now, is a collection of our lot of information from the time of birth, even maybe from the past life. We are carrying some information and we are adding a lot of information with that from the childhood, from our parents and teachers and the relatives and surroundings and environment and all. We make a wonderful knowledge bank, and on that basis we are living. And if this knowledge bank is perfect, we are perfect. We know what to do. Unfortunately, the history of our the Ravi, which I mentioned, that he was lacking something. He was lacking in his training, and that lacking has reflected in his behavior, and that will lead to some disease like that. So the childhood experiences, knowledge, memory is good, because we are every time. Now I can talk to you as an Ayurveda doctor, or those who are working in the Ayurveda field, with the presumption that you know many things about Ayurveda. I don't tell that what is Vata, Pitta and Kapha when I am telling this, because it's there. So every knowledge is an add-on thing. So whatever we learned yesterday, we are adding something to it. If that yesterday's knowledge is not there, what will happen? So we have to maintain this memory. So this is very important for a person for his personality, his mental health, his physical health, his previous knowledge is very important. And those who are undergoing through very severe psychic trauma, they lost all these things. They become mad because of that. They are kind of developed a retardation kind of thing. They retarded their growth. At some point, maybe they were feeling that a 2-year-old child or a 3-year-old child, and they are behaving like that. This is very difficult. You might have seen that some gigantic figure coming to you, but while seeing a cockroach, he can jump like anything with the fear. What makes? Because immediately he saw that cockroach, he became a little child, 3-year-old child. That memory brings him in his forefront, and he started feeling fear. I'm sure that many of them are laughing because many of them are having such fears, no? Because such kind of cockroach or some frog or something like that. Many people are having such phobias. So this is because of that we are retarded at some point of life in our development, psychological development. So this affects our personality, and this leads to many diseases. Because in my personal experience, I can say that whenever I try to get into any disease for that matter, it will end up with a childhood trauma. So I can tell one example that one patient came with rheumatoid arthritis and she's a 37-year-old and like that. So she was suffering for a long time without that, and she is in a very difficult situation. So when I was doing this meditation on that, finally she realized the very important factor that when she was 1.5 year old, her mother got another two children as brothers, twin brothers, and because of at that situation she was not in a position to look after this girl. So what she did is she gave this girl to her grandmother and took care of the other two children. And by that time, his father divorced her mother. So it was a big trauma for mother. So mother was in such a very poor situation, she was not able to look after this child. But as this little girl was feeling so much offended, because I am being the eldest daughter, my mother did not give love and care. She just throw me away. This anger and fear, and this frustration, she carried throughout the life. So she was doing everything in her life just to make her pain to her mother. Even her marriage and many things in her life, she made it very purposefully to make harm, mental harm to her mother. Because the revenge she was carrying is, and because of this revenge, it is like when you look at this autoimmune diseases, it will be very clear that when you are trying to punish somebody else, which you are unable to express, especially mother, she is having a hostile attitude, but she cannot express it. So she is holding inside. So what will happen? It is take a U-turn and it will punish yourself. This is what is happening when somebody is doing self-information. When somebody is got affected, I remember that situation when MGR was ill and he got stroke, and his fans were in a position that they were not able to express their anger to anybody. If this stroke was done by somebody from the other party or Karnataka and all, they can destroy all these their properties and all. But it is done by God. So what they can do, they become helpless. They just pour petrol on their head and set a place. So this is the kind of a reaction there. So most of the autoimmune reactions, autoimmune diseases, you can find this. So in her case also, she kind of developed a kind of an autoimmune reaction, and it became the arthritis, and she was suffering a lot. So it took that 37 or 35 years to understand that she was carrying this anger. And once we realized that, she could change her attitude, and it definitely helped her. So these things are very, very important. So Ayurveda has identified these very important factors. That's why it is taken as the basic reason for many mental health problems. So when mind is disturbed, we need to address that part. How to address, how to resolve, or how to give a protective barrier in this mental disbalance when there is rajas and tamas is increased. So we need to increase sattva. That's all. By increasing sattva, we can manage it. Sattva raja. So by improving the quality of sattva, we can reduce this rajas and tamas. Then we can protect, we can prevent many ailments. But if it is not happening, if the person is a hina sattva, if he is a hina sattva, what will happen? He cannot be prevented at that level. So it percolates deep inside. Okay, we have next barrier of army to prevent the disease. That is the ojas. But ojas is also become weaker when what happens? Bhova should have Bhova. So when there is an emotional disturbance is there, even ojas also become weaker. So then the disease further percolates into the level of dosha. Okay, Dosha can prevent. When the doshas are in a balanced state, we can protect ourselves and body can be healthy. But again, we know that what are the factors which is provoking doshas? Anger can provoke pitta. Sadness and fear can provoke vata. And laziness can provoke kapha. So all these emotions are there also takes a significant role. So finally, then if these three layers are not being able to protect this situation, then it transcends to the body and it will develop as a somatic disease. So psychic disease later develops as a psychosomatic disease and later finally it manifests as a somatic disease. What Ayurveda says? Very simple. We have a Sattva treatment. Manaso, Jnana, Vijnana, Dhairya, Smriti, Samadhi. These are the 5 components, 5 tools which is given by Charga to deal with, to fight with this disease, with all these psychosomatic diseases. We have these 5 tools. If we understand these 5 tools, it's perfect. So how to understand this? Jnana has given further details about how this jnana works. Vidya, Siddha, Madhi, Veda, Prajna. They are the synonyms given, but we are having this proper understanding of these 5 components. That gives the proof that how we can work with the jnana level. To give a lost D or retain the lack of D by giving the proper jnana. Vidya is nothing but the information, guidance and advices and like that. Siddhi is to train them to give more additional skills to manage the situations. I'm not going to go into the detail, but Madhi is very important. It is similar to that of modern indirect counseling. So Madhi gives an opportunity to look at that the problem, the mental problem from different perception and analyze it from different dimensions. So then they will have a immediate insight to that real problem and they can solve it. And Mena is a kind of like it is defined as the sacrifice of ignorance. Mena. That means we have some kind of a core beliefs or wrong beliefs which we carry from a long time, maybe from childhood onwards. So we need to sacrifice that. Then only we will have a real knowledge. Because some people are there, nobody likes me. And or I cannot entertain anybody. Or I am not good looking. So these are the things we are carrying for a long time. These are the core beliefs we are carrying. But having a proper evaluation and analysis, you can identify that is it true or not. By having this realization, you can change this belief and you can become more mentally strong and stable and confident. So prajna is that the inherent possibility to get a right knowledge, because we are all basically Atman. Atman knows everything. When we try to feel this Atman, the presence of Atman, the real knowledge appears, the revelation appears, the realization appears. Vijnana is to know that who am I. If you know that who am I, the problem settles. That is the ultimate solution. From the very beginning, we are trying to, we are suffering because of that. We consider that ourselves as the ahankara or ego, and we are working with that, and we are trying to develop this ego, and we forget about the me beyond that. So realizing that we will be happy to love everybody, we will not be having any hostility, we are compassionate, we are having the empathy for everybody, and so because we realize that oneness among all, like unity in diversity. So we realize that all these people who are sitting here is from the same source, Aham Brahmasmi. So when we have this kind of a realization, nobody will have any mental problem. So it's a very unique point which Ayurveda proposes, because in the modern psychology that is not there. So this realization and how it is working in psychology, because the person who is in a spiritually elevated person level, they will not carry any kind of a depression or anxiety or a phobia, because that they are realizing that who am I. Then the next point is Pradeep. As I told that we need to have a journey into our past, introspection of our experiences in the past, and identify that what went wrong, where you have fault. So identify these faults and then rectify it or realize it. I don't say that you rectify, just by realization, just getting a revelation that what is going on, you will become better. So like that, you can keep on realizing things in your life by transcending it deep into your past memories. So the Smriti technique which we developed in order to introspect our experience. So we used to do a kind of a therapeutic technique. I will explain a little bit later. So these are the 8 points which Chara has given. Nimitta, Rupagrahana, Sadrisya, Vipareya, Sattvanagata, Abhyasa, Jnana Yoga, Punasudha. So we can make use of all these techniques to deepen into our memory, exploring the causes, or trying to identify the similar shape images which we encounter during our dreams or in our subconscious state, or identifying the similarity within that situations, and like that, then getting the contrast of any memory and sattva, and making the person more deeply relaxed. Then a repeated practice of this memorization of the past, and jnana yoga, the having this correction of the knowledge, wrong knowledge, and the Siddha. So this because of lack of time, I am not going to explain it, but we can use it very practically. Each one of these points to make a person get into the past life, past period of life, even past life also may be possible according to Ayurveda. This may be possible, but I will try that. But in this present life itself, we have a lot of baggage to look into. Why should we think about the past life? Many people used to ask whether it can be used for regret as a regret therapy and all. But I think that at this life itself, we have many things to sort out and resolve it. So it gives an impression that what are the experiences in your past life which is make your behavior change. What are these experiences influence your personality, and what are the reasons you provoke your heart disease or cancer or arthritis or asthma. So you will find it very interestingly that you will find the reason for almost all these diseases, the psychological backup of all diseases. So based on that, this Pradeep meditation is developed, and it is a guided interactive meditation technique. So we will be putting the person in a sattvic state, making the person deeply relaxed, and we will start trying to interact with them. And during this interaction, they get more and more deeper awareness, and they can transcend to their memory. And as they go deep into their memory, so they come out with a lot of emotions. Some people may cry, they may feel fear and sadness. Okay, fine, let it be like that, because all these things are helpful for them to realize that what is going on. Because usually we have a tendency to mask it or cover up all this negative emotion, that's why it is piled up. So here we are allowing the person to realize that what emotions are, because we are working more with the emotions. Once we identify that emotions, the involvement of emotions in this particular disease, it is easy. Because once they are crying, cry it out, fine. Sometimes I have wondered that after crying continuously, maybe hours together after this meditation, they even lost their swelling, they even lost weight for that, because the tears are collected and held up in the body. It appeared as a kind of a swelling. So like that, allow the person to forget the emotions, identify and forget them. It will get that. For that, meditation is necessary. Usually it takes 1 to 1.5 hours to have this interaction with people because we make use of all these 5 components. Jnana, Vijnana, Dhairya, Smriti, Samadhi. All these components are together being applied during this meditation so that the person can transcend to higher state of consciousness. So, higher state in the sense from the Jagrat to Sapna, from to Sushupti to Turiya. If a person just experience a state of Turiya for a fraction of a second is enough for getting a revelation, and that itself is sufficient for them to cure some of their chronic disease. And Samadhi we have often interpreted as a state of death. No. Samadhi has got many different stages, like Samjara Samadhi, Samdara Samadhi, Vidara Samadhi. It's all like different levels of realization and revelations in our life. So each stage of this Samadhi makes our personality different, more positive. We become more confident and happy, and we become more healthy in that. So what actually is needed is that all the human being is a collection of trillions of cells in our body, is it not? And these trillions of cells and organs have their own intelligence, their own plans in their life, their own lifespan. They take birth, they live with us, and they die out someday. It's very interesting to know that I'm just like a collection of so many millions of human cells. Like I myself is like a country. Like India is having, the Bharata Mata is having 130 sorts of tissues or cells in his body. Many people are taking birth and dying at some point of time, but everything is for the sake of Bharata Mata. So same thing is happening to me also, because they are living for me, and my blood cells, RBC may live for 120 days, and white blood cells may live for 5 days, and the beta cells for 2 hours. Fine, neurons may live longer, fine, but everything is living for me, and all these microbiomes in the whole body, millions of microbiomes are there, so they are also living for me, and they sometimes so it is a collective form. So what these different cells and different microbes are collectively performing because of the presence of my Atma. Is it not? There is me. If I am not there, the moment it will disperse. When I leave this body, my Atma is leaving this body, that moment they start dispersing. So it's very interesting about that. So what is very important? We have to feel our presence. We have to feel the presence of the soul. That is what is called meditation. Meditation is nothing but being aware of everything. So when we are not in the position of, we are not in our, the soul is not in its own position. This is like a nursery classroom. When in nursery classroom, the teacher is not attending the students, what will happen? They will be making fun, fighting each other. Like in our body, also many tissues and cells are fighting each other, and then it gives a disease for us. But as soon as the teacher appears, everything is in order. So that is the reason why our Acharya has given the word swastha. When the soul is in its own position, we have help. So how to attain it? Be aware. Awareness is the only solution. When you are aware, you are healthy. When you are unaware, you are absolutely in a disease condition. So Smriti meditation, we are trying to develop and scientifically we are doing some research in particular area. We are now in postgraduate department 2-3 studies are going on. So we already published some papers and I did some studies in Moscow State University, the EEG changes in that. So we identified that theta domination in this case of EEG when we are undergoing meditation. And also we are studying with a simple device like we used to. By using we can record the real time, we can monitor the real time EEG patterns, and so it shows that when we are in a different emotional stage, we have different EEG patterns. So we can make it as even a marker for emotions. So while a person is undergoing a meditation, we can observe that what kind of EEG patterns they are having. We can see it in our mobile. Unfortunately, I wanted to show it in front of you, but due to some technical reason, it was not working. And so, this different emotions, when it is in happy state, it will have a different pattern of the brain waves. And when it is in a content state, its a pattern is different. So, when it comes to the topic which we are discussing, the cardiology, how it is going to work? This presentation, how can we work and how it is helping in the cardiology patients? First of all, as we understood that there is a strong relation between the psychological factors or psychological disorders and the cardiology. So, this cardiovascular meditation very well realizes that the factors which is hidden behind this anxiety, depression, and the post-traumatic stress disorders and panic attack, and we can almost easily manage these diseases by using this meditation technique. And not only that, we can train people to get rid of from this smoking or binge eating habits or other alcoholism and all this. So what we are doing is that we are making use of the possibility of yoga, because the idea is nothing but application of the yoga in its real sense. Because it is nothing but stretching the process. So what is pranayama? Pranayama is you are observing the breathing and you become conscious of each and every stages of breathing. Shasa prasyasya gazing cheta. So the breathing is like this. So you have to make it like this, very slow and stretching. Finally, kevala kumbhaka. So when it is happening like that, when you are stretching a process, you will realize that what are influencing this process. You will identify that what emotions can change this breathing pattern. Because it's very clear. When you are having anger, how your breathing changes? Short breathing. Okay? When you are sad, shallow breathing. When you have fear, this is stuck of that. So in all the breathing changes, there is an emotion involved. So when you are trying to prolong the process of this breathing, you will identify the emotions inside of it. And by realizing it, you can understand the reason why a person is prompt to take some alcohol or smoking and like that. So this can help the person to change their behavior. So this is even useful in binge eating methods. We are using meditation to identify that what emotions they want to cover by eating too much of food. Once they realize it, they can modify this behavior. Because all these binge eating, smoking are all risk factors for cardiological problems. Even American Heart Association is very well accepted that the concept is that meditation is very helpful in cardiovascular risk reduction. And even some symptoms we can modify by doing meditation like arrhythmia and premature ventricular contracture and Prince metals angina vasospasm can be reduced, and essential hypertension, which is where in all these situations two things, emotional factors or energy factors are involved, because in all these functional disorders prana is involved. There is a prana disbalance. As I mentioned, if you do pranayama properly and the asanas, in asanas also we need to give more stretching. We need to be aware of the minute aspect of the process, and like that we can identify the reason which motivated this kind of a misbehavior. So here it is mentioned that how this stress is influencing this arrhythmia, and that's why this kind of method will be very useful. And meditation, it is proved that many studies are conducted in Harvard Medical School. Of course, I am very proud to see that how people from abroad, especially in developed countries, they are considering the importance of our meditation and yoga to deal with the many non-communicable disorders. So with that, I would like to request you to pay more attention to our very important knowledge bank, that is our Sattva treatment. And very seldom people are nowadays giving importance to the Sattva treatment, and without incorporating the Sattva aspect in the treatment, we are not going to be successful in treating almost all the diseases. From the very beginning, Vagbhata has mentioned that Ragadi Rogan. So he has given such importance to ragas and the emotional factors for diseases. So every time Ayurveda is repeatedly telling that these emotional factors are very important, we need to address. And when even in psychological problems, we often try to treat with medicines. But more than medicines, I am sure that non-medical, non-drug therapy like this meditation and these 5 components, Jnana, Vijnana, Dhairya, Smriti, Samadhi. If we can understand these 5 points in detail, you will be a successful psychologist, Ayurveda psychologist. Not only Ayurveda psychologist, you will be a successful Ayurveda doctor in all sense. With that, I would like to thank once again for all the participants for patient listening, and the organizers for me giving me the opportunity, and my chairpersons. Thank you very much. Thank you, sir. I would be happy to answer some questions if you have. Thank you very much.
Thank you, sir, for taking us into a world of calmness, self-awareness, and experience the very subtle principles of heart. Awareness is the most important part of healing. Today, sir has taught us about the importance of web of causation of diseases, risk factors in cardiovascular diseases, how mental health disorders are connected with heart disease, different induction methods, and so on. If any questions, delegates can kindly write it in a sheet of paper or can stand and ask.
I would like to request Dr. Vijendra sir, chairperson, to share his opinion.
Good morning, everybody. Today's speaker, Professor Dilip Kumar sir, co-chair Professor Pankaj, and Dr. Prashant, and all the dignitaries of the day.